this morning, Leicestershire schools went back to the classroom last week, but for millions more pupils across the England and Wales who returned to school this week, it's being feared that it could cause a spike in COVID cases. Pre-term COVID testing is being used to limit infection, but rules on social distancing and face masks have gone. Scientists have warned of a rapid rise in school cases without such measures, and experts have recommended jabs for healthy 12 to 15-year-olds. Dr. Duncan Robertson, policy and stats expert from the School of Business and Economics at Loughborough University, joins us now. Dr. Duncan, thanks for taking the time as ever. So are we seeing a rise in cases among school children?
So, I mean, with all these things, there's been a lot of testing that's going on. So, of course, that's going to pick up the cases. But what we really need to see is what's going to happen over the next couple of weeks as schools go back and as mixing happens. And I think there's an expectation that cases amongst school children will increase quite significantly over the next few weeks. And
is that something we should be concerned about?
Well, with all these things, I mean, thankfully, one of the only good things about COVID is that the effects on children are much less severe on average than older people. So we're going to see cases, and we are potentially going to see that moving up through the age group. So I think that's what we've seen in previous waves. When cases have started in young people, they tend to move up into older people. So if we get a large number of infections in school age people, we are potentially going to see that move up the age groups, and that's potentially what's going to be significant in the weeks going forward.
With that all in mind, then, I mentioned in the introduction the JCVI recommended against jabbing 12 to 15-year-olds. So why was that, and what's the risk level for kids at that age?
So what the JCVI did is they looked at a fairly narrow definition of the benefits and the costs of vaccination for the 12 to 15 age groups. And one thing to say is as you mentioned, even though they haven't recommended vaccination of all 12 to 15-year-olds, they have said that the most vulnerable should have vaccinations amongst that age group. So that's good to know. And I think if people do have vulnerable children, then it's good that they are able to get that vaccination. But I think one thing to say is that, they didn't recommend vaccination because of this fairly balanced costs and benefits. But we may see, that being changed over the next week or so when, the government makes a decision about it. But what is kind of important to say is that's going to make no difference at all in terms of cases spreading in the next couple of weeks. So regardless of what the JCVI said, because they said it so near the close of the beginning of term, it's going to have very little effect on transmission in that school age group.
What about other age groups in terms of vaccine take-up? What have we seen in terms of levels of different ages taking it up?
Well, we see, of course, the oldest in society and the most vulnerable have had the longest time to have a vaccination. And now we're getting to the sort of 16 and 17-year-olds. The take-up has been very significant, and that's good to see. But with all these things, we do have the kind of issue that these vaccinations haven't been taken up equally across the population. So if you look at, say, if you're an over 50-year-old, you're 5 times more likely to be fully vaccinated if you're white compared to if you're black. And the same goes for deprivation. You're 4 times more likely to be fully vaccinated if you're in the least deprived group compared to the most deprived group. So what we're going to, potentially see is this isn't going to be a sort of equitable spread across the country. It's going to target the people who are susceptible, and those susceptible are, by definition, children that haven't had COVID so far. But also, it's going to kind of target those communities, more deprived, more ethnic minority communities as well. So it's going to be quite a potentially difficult winter.
Yeah, I mean, I was going to touch upon that. It's nice out there today. It feels like summer's back, but it won't last too long as we head into the winter. Of course, last winter we saw another lockdown. Is there concern that cases will rise quite badly again in the winter?
Well, we already have 1,000 people in intensive care beds across the country compared to about 4,000 at the peak. And that's a number that sort of is at the moment sort of creeping upwards. And we don't know what's going to happen, but it's likely that there's going to be a spread through these age groups. But I think one thing that is potentially worth looking out for is the rate of influenza infections. So what we really don't want is to have high COVID cases and high influenza cases over winter. So there are sort of rumblings about maybe there be a rise of influenza cases in places like India, and I think if those two things happen, there'll have to be introduction of measures. So we're not necessarily talking about a severe lockdown, but there may be recommendations about mask wearing and those sort of things coming back, because with all these things, cases once they start doubling, they have a habit of doubling again.
Dr. Duncan Robertson, policy and stats expert from the School of Business and Economics at Loughborough University. Thanks as ever. Of course, another update next week.